Hello everyone, this is Ola. In this video I'll go over the cranial nerves. There are 12 pairs of cranial nerves. The first three ones begin with O. So the first O is olfactory. The second cranial nerve is O, optic. The third is O, oculomotor. TTA, number 4 is T, reticular. Number 5 is T, trigeminal. Number 6 is A, abducens nerve. FV, number 7 is F, facial. Number 8 is V, vestibulocochlear. GVA, G is number 9, glossopharyngeal. V, vagus, number 10. A, accessory, number 11. Then the 12th cranial nerve is H, hypoglossal. Now, let's go over them one by one, starting with the olfactory nerve. The olfactory nerve is purely sensory. It carries the sense of smell. Then the olfactory nerves enter the skull through the little holes of the cribriform plate of the ethmoid bone to end in the olfactory bulb. The second is optic nerve, and also it is purely sensory. It carries vision. Then the optic nerve enters the skull through the optic canal. Then the right and left optic nerves cross over to make the optic chiasm. The third cranial nerve is oculomotor. The fourth is tracheal, and number 6 is abducens nerve. Number 3, 4, and 6 supply the extraocular eye muscles that move our eyes in different directions. There are 6 eye muscles. 4 of them are rectus. Rectus means straight fibers. So we have the superior rectus, looks up. The inferior rectus, it looks down to the ground. The lateral rectus looks laterally away from the middle line. The medial rectus looks medially close to the nose. Then we have 2 obliques, the superior oblique and inferior oblique. The fourth cranial nerve supplies the superior oblique. Number 6, abducens, supplies the lateral rectus, and then the remaining muscles take their signals from the third cranial nerve, the oculomotor nerve. So this acronym helps to remember the innervation of the eye muscles. LR6, lateral rectus supplied with 6 abducens. Remember, abduction means moving a limb away from the middle line. So the abducens nerve does abduction of the eye, helps the eye to move away from the middle line. Superior oblique takes number 4, which is a tracheal nerve, and then the remaining get their signals from the oculomotor nerve. In addition to that, the oculomotor nerve has a parasympathetic function because it constricts the eye pupil. The 3 nerves, 3, 4, and 6, go through the superior orbital fissure. Now, cranial nerve number 5 is the trigeminal, and it is for facial sensation and mastication. As its name indicates, it has 3 branches, V1, V2, and V3. V1 goes through the superior orbital fissure along with number 3, 4, and 6. V2 goes through foramen rotundum and gets a sensation from the maxillary region of the face or the middle part of the face. And V3 goes through foramen ovale and gets sensation from the chin, the lower part of the face. V3 also supplies the mastication muscles that helps to elevate the mandible and to chew food. V3 is the nerve carrying sensation from the chin and lower face. Also, it carries general sensation from the anterior two-thirds of the tongue. General sensation like touch, like pain, like temperature. So, feeling the food touching your anterior tongue is carried with the V3 or mandibular branch. Cranial nerve number 7, the facial nerve supplies the facial expression muscles, so it exits through the stylomastoid foramen and gives branches to the facial expression muscles. Also, the facial gets a taste from the anterior two-thirds of the tongue. So here is the tongue, and from the anterior two-thirds, the facial gets the taste of the food, if it is sweet, salty, spicy, sour, and then V3 gets the general sensation like the food touching your tongue. The facial nerve also has a parasympathetic function because it supplies to salivary gland, the sublingual salivary gland, and the submandibular salivary gland. So the facial nerve supplies two sublingual and submandibular salivary glands. Cranial nerve number 8 is the vestibulocochlear nerve, which is purely sensory. It goes through the internal acoustic meatus, carrying hearing from the cochlea of the ear and carries the body position through the semicircular canals to help keeping balance. The semicircular canals detect the rotational movement, and the vestibule is for the linear movement, and both are carried with the vestibular branch of the vestibulocochlear that joins the cochlear branch so that the vestibulocochlear nerve gets that going to the brain to help keep balance. The three nerves going through the foramen, the jugular foramen, are GVA, glossopharyngeal number 9, and vagus, which is number 10, accessory 11. The three of them go through the jugular foramen, GVA. Number 9 is the glossopharyngeal nerve, and it supplies a muscle that we call a stylopharyngeus muscle. It's a swallowing muscle helping us to swallow food. Also, the glossopharyngeal nerve carries taste and general sensation from the posterior third of the tongue. The glossopharyngeal nerve has a parasympathetic function as it supplies the salivary gland in front of the ear, which is the parotid gland. Cranial nerve number 10 is vagus nerve. The vagus nerve supplies all the pharyngeal muscle except one, which is the stylopharyngeus, getting its signal from the glossopharyngeal nerve. It is the major parasympathetic nerve, the longest one. It goes down to the distal third of the transverse colon, and it is the major parasympathetic nerve helping with digestion, slowing down the heart, and it is also sensory to the visceral. Like if you are feeling pain in your stomach, the vagus nerve is the one to carry that sensation. So we have four nerves helping with the parasympathetic nervous function, and they are 3, 7, 9, and 10. Number 3, oculomotor, constricts the eye pupil. Number 7 supplies two submandibular and sublingual salivary glands. Number 9, glossopharyngeal, supplies the parotid gland. And then number 10 is the major parasympathetic nerve. Number 11 is the accessory nerve. It exits through the jugular foramen, supplying the sternocleidomastoid and trapezius muscle that elevates the shoulders. So cranial nerve number 11 elevates. 11 elevates the shoulders. Then cranial nerve number 12 is the hypoglossal nerve, which is purely motor. It exits through the hypoglossal canal, and then it supplies motor innervation to the tongue. So it moves the tongue. Now, let's review the cranial nerves by this cranial nerve face. So there are two nerves for the face. Number 5, trigeminal, is the one that is sensory, getting sensation from the face. And number 7 is the one that supplies the facial expression muscles. So it is motor to the face. Then number 1, which is the olfactory nerve, makes the nose, so it is for smell. Number 2 are the optic nerves, and they are to carry vision. 6, abducens nerves. The abducens nerve moves your eye laterally away from the middle line by supplying the lateral rectus muscle. Number 4, tracheal nerve supplies the superior oblique muscle that moves the eye medially and down this way. The remaining extraocular muscles take their signals from number 3, which is the oculomotor nerve. Also, the oculomotor nerve constricts the eye pupil. Cranial nerve 8, vestibulocochlear, makes the ears. It carries hearing and balance from the inner ear. In front of the ear, there is the parotid gland that takes number 9. So 8 and then 9. 9 is the glossopharyngeal nerve, and it supplies the parotid glands. Now, the anterior 2/3 of the tongue get the general sensation from V3 and taste from number 7, which is the facial nerve. Number 11 makes the shoulders, and it elevates shoulders. 11 elevates. Hypoglossal moves the tongue, so it is a motor to the tongue. If you look at the posterior third of the tongue, the general and taste both are carried with cranial nerve number 9, which is the glossopharyngeal nerve.